What is the best prenatal you could take? That's a question that I am always getting asked. And the truth is, there's not one best prenatal vitamin out there. It has to do with what vitamin you're actually going to take, what vitamin is going to agree with you, right? Not give you too much nausea or constipation. It's going to prevent you from being able to take it. It also depends on your own personal needs, if you have any risks in your pregnancy or pre-existing conditions, as well as where do you live? What's your access like to food or these vitamins, right? The cost of them as well. So what I'm going to talk to you about here today is how are you going to choose the prenatal that is best for you? Because the truth is, understanding more about the ingredients that you are taking and what you need is what is going to help you to be able to take the best prenatal for you. I'm Dr. Kira. I'm a board certified naturopathic doctor in Ontario with a special interest in women's health, fertility, and mental health. So today we're going to talk about how to choose the right prenatal for you, what are the best ingredients to look for, what doses that you want to look for in those, and the different forms of prenatal. Is there a best one to take? So let's start there. There are so many different options, right? We can take pills, we can take powdered drinks, we can take gummies. Is there a best one to take? Well, I always like to look at the doses that are in there. So it can obviously be most convenient to take, one pill one time a day. And if that has in there what you need, great. But a lot of times what maxes that out, right, is that pill is only so big. So you can only fit so much in there at once. But what we can do is definitely look for one that, perhaps we only have to take once a day so that can take out the burden of needing to remember to take it multiple times a day, for example. So sometimes those pill packs that they have now where all you have to do is tear it open, right, and kind of take that handful, that can be really convenient for some people to take. Again, when we're looking at the amount that we can get into something, that's where I like to kind of question gummy vitamins there. But again, if gummies are the only things that you can stomach, the only things you're willing to take, are going to consistently take, as long as, we'll talk about what are those minimum requirements in there, that can be fine if that is what you are getting. But gummies are probably my least favorite on the list to recommend for that reason. One of my favorites on the list to recommend is a powdered prenatal, because we can get a big scoop of a good dose of all of those things in there, so we can still only have to take it once a day. And if you don't love swallowing pills, or you don't like swallowing a handful of pills, then a lot of times we don't have to do that either, and we're really getting those therapeutic doses in. Some things that can prevent people from taking a prenatal, for one, can be remembering. So that's why we want to choose the form and the timing, right, for us to take that we can remember the best. So we make sure that we get that in consistently. So another big thing that patients often report can prevent them from taking a prenatal is if it makes them nauseous, right? If it makes them nauseous or if it makes them constipated. And so where we can help, some strategies we can use to help to prevent that nausea is taking it on a full stomach. Okay? When we have a good dose of ingredients in prenatals, for one, that can sometimes cause us nausea, but specifically zinc and sometimes even iron tend to be the culprits of causing nausea. So if we take them on a full stomach, that usually helps us experience less nausea from them. And when we can take them, in the evening or even right before bed, a lot of times then we are already sleeping when any of that potential nausea might arise, so it doesn't bother us. So if you are taking a 1-a-day dose, that can be added to the convenience of it, right? Just taking that once a day in the evening, after dinner, or right before bed, and then it can make it a lot more palatable for us to take there as well. Sometimes as well, taking a half dose, so a little bit less, as long as, again, that still has those minimum requirements in there for us. That can be helpful as well. And so what are those minimum requirements in a prenatal vitamin? The number one thing, and actually the only required or regulated thing to be in a prenatal vitamin, is folate. Okay, we need a minimum of 400 micrograms of folate in a prenatal vitamin in order for it to be approved or considered as a prenatal, and that's actually the only requirement there. So in areas where we can't don't have a lot of access to things or can't afford much in there, it's just simply folate is the only thing that is recommended to take, and that is because it's the only thing that's actually been studied and shown to be absolutely essential in order to prevent neural tube defects in a fetus. Okay? And when we have neural tube defects, we can experience things like spina bifida, issues with the nervous system. And it's something that happens quite early on in pregnancy, typically around week 5. So it is something that we want to be taking leading up to that pregnancy and during that first period of pregnancy, and then really all the way throughout. Folate can also help with egg quality, healthy cell division, which are all really essential things for us to being able to get pregnant. So it's a great thing to have in there. Beyond that, the next biggest things that we want to look for in a prenatal, for one, to me, is iron. Okay? We are creating a whole new blood system, right? And so we have a lot higher demands for that. And typically as women, we oftentimes can have lower levels of iron to begin with because we do lose iron every month as we menstruate. And sometimes it can just be harder for us to absorb or store. So making sure we are supplementing appropriately with that can be really helpful. Other things are vitamin D. Good levels of vitamin D and B12 as well have been shown to be associated with lower levels of fertility. So making sure we have good levels of that in that prenatal, and then again, higher demands during pregnancy, so great to support with those as well. Now, another question that I commonly get asked is taking a prenatal vitamin going to make me more fertile? Does it contain hormones in it? What in it specifically makes it that prenatal vitamin? Which is a great question, right, based on its name. But the truth is, a prenatal vitamin is really just a good quality multivitamin. So when it can help us get pregnant, right, or be more fertile is when we are actively trying, right, and we want to make sure that those levels of nutrients that we need are up, right, and high enough. But some more pregnancy specific things where a prenatal can actually help us to be able to get pregnant would be egg quality supporting ingredients, for example. So that's where we're starting to see more commonly in prenatals things like CoQ10, L-carnitine, and then vitamin E and zinc. Those are all great antioxidants, right? Or, supportive of egg quality and sperm quality, right? And their health there. The other things that can sometimes help us to be able to get pregnant is things that help us to balance out our hormones and or promote ovulation. So again, a new ingredient that is popular to be in some prenatals is inositol. Inositol can help to promote ovulation. It can help to balance blood sugar. It can even help with anxiety. So all of these things do help with being able to get pregnant. So inositol can be good for that. Vitamin B12 can support with this as well. Magnesium and vitamin B6 as well are great things to look for in your prenatal. Vitamin B6 can be really balancing for our hormones, and magnesium can be really supportive in balancing of our hormones. Magnesium can also help with stress, it can help with sleep, and it can help with constipation. So if we are experiencing constipation from our prenatal, from the iron in there, if there's magnesium in there as well, that can be a great thing to help us balance it out in there too. Looking at B vitamins in general, having a good complete B vitamin in there. All of our B vitamins do something a little bit different for us, but help with so much energy and metabolism in the body, really help with a lot of processes going on over there. So those are always great things to make sure that we look after, that we have going on. As much as there isn't huge studies on those B vitamins specifically needing to be super high to help with fertility, as much they are definitely very safe for us to take and can be helpful for energy, for mood, for all the things that can add into our support and ability to get pregnant overall as well. Final and newer things that we are looking at in prenatals that are starting to be included are things that can really help to support brain health and development in the fetus. And so things like choline and omegas, especially DHA, are really being studied, looked at, and talked about now. So looking at those things in there have been shown to help a little bit with fertility, but really mostly brain health and development in the fetus. So those can be great things for to look forward to have included in your your prenatal there as well. Calcium can also be a nutrient that can be very needed to help us produce great bones, right, of the baby, and have some added needs for that as well during pregnancy. But what I want you to keep in mind is that calcium can inhibit the absorption of iron. So I don't actually like to see calcium and iron in a prenatal at once because they can kind of cancel each other out, right, with our ability to absorb them. So what I actually like is to have calcium as a additional separate supplement. Calcium supplementation, especially a liquid one. I love a good calcium, magnesium, vitamin D combination supplement as a liquid. Can be really helpful and supportive with reflux. Okay, and that can be a common issue in pregnancy. So I actually like to take calcium away from my prenatal separately, and then use that as that added support. It's kind of like a healthier version of TUM. So you're supporting your own reflux and supporting that health of the baby. One of my other favorite ingredients that I'm starting to see in prenatals is ginger. So ginger can be excellent for helping to prevent nausea, right? And nausea is super common, especially at the beginning of pregnancy in that first trimester. So it can be used as treatment or prevention of nausea, which is great to see. But it can also be used as an anti-inflammatory. And high levels of inflammation has also been associated with low levels of fertility. So starting to see ginger in prenatals is something that I really like to see to help keep inflammation low or lower inflammation, and then have that added already built-in support to help to prevent nausea as well. The next biggest thing that is being talked about with prenatals lately is what's the best form of all of these ingredients to have in that prenatal. And then, of course, I always like to look at dose, because if we are not having enough of something, then it's not actually helping us out that much a lot of the time. We can just end up having expensive pee as we excrete it. So I like to make sure that we are getting the therapeutic dose in there that's actually doing something to make a difference for us. So let's chat about the forms that you want of each of these ingredients and how much we want of each of these ingredients in here. Okay, so when we are looking at a few specific ones, right? So folate is the first one that comes up. So what has been studied and proven to prevent neural tube defects is folic acid. Okay, folic acid at a minimum dose of 400 micrograms a day. And that was a big study done. It was shown to prevent neural tube defects, which is great. It improved neural tube defects in about 60% of the population, which is great. And it's also about the same number of people who can methylate in our society. So in order for that folic acid to be actually uptaken and used by the body, we need to be able to methylate it. And about 40% of the population cannot methylate. And so when we can't methylate, then we can't actually absorb and use that folic acid. So if we look for the form of methylfolate, that methylation has already happened. So whether we can methylate or not, methylfolate has been shown to be a great active source of folate that is in the body that can absolutely be used by the body. However, there has not been any studies to show or prove that it necessarily prevents those neural tube defects in the same way as folic acid, and we might never actually get that study because all this money was pumped into completing these studies, and it's been shown to help and improve it in so many people. So would it be ethical to not provide, right, folic acid to them, right, at that time? And would the funding be there the same when we've kind of got the answers that we need? So that is a decision that you just need to be more informed about and make those choices for yourself. If folic acid is going to be fine for you, if you do need that methylfolate, if you need that support with methylation, if you do not know if you are a methylator or not, that is something that you can find out, or you could perhaps take both, right? If you find that you need both, if you feel best, taking that could be a good option, a good choice. And folic acid is the synthetic form of folate. Methylfolate is naturally found in nature, right? And so if that impacts, right, your thoughts on our body's ability to know what to do with it, right, and what not to, there is some information, some things coming out with perhaps that overload of folate that we can't use, and how that can also affect and impact the body. So there's been some correlation with perhaps depression, postpartum depression, some things with autism or allergies as well too. So those are all important things to look into for yourself as well, to make that informed decision as to whether folic acid or methylfolate might be the best choice for you, or if you feel most comfortable with one or the other, or combining both, that could be a choice for you as well. Regardless, we need that in a minimum of 400 micrograms a day. Okay. When we are looking at iron, one of my favorite forms of iron is iron bisglycinate. Okay. It's well absorbed by the body, and it tends to be gentle on the stomach. It doesn't tend to cause constipation, which is great to see. When we're looking at that, we want around 20 to 30 milligrams of iron a day for us. And so that usually equates to about 100 milligrams of an elemental iron, because whatever that iron is attached to, in this case, the bisglycinate form, that adds to that weight. Okay, so that's the difference that we are looking at there. When we're looking at B12, methylcobalamin, again, B12 is something that needs to be methylated in order to use, so we want to look for that methylated form. In terms of vitamin B6, P5P is a great choice for us to take there. When we're talking about vitamin D, right, it's typically vitamin D3. Most forms of that is fine. It's usually calciferol there, but I do like to see that in a minimum of 2,000 IUs a day for you. Vitamin D is a fat-soluble vitamin, so we can have too much in there. So we can have that our blood tested, because it is stored in our body. But usually at that 2,000 IUs a day, that usually is enough to maintain, but also increase a little bit, right, for us, those of us who are low, and it tends to be at a very appropriate dose for most people. When we are looking at vitamin B12, that methylcobalamin there, we want to have about 1,000 micrograms a day in there. Anywhere from 500 to 1,000 can be good taken orally, but we usually need about that much, again, in order to not only maintain but then increase those as well. When we are looking at vitamin B6, that P5P, in terms of nausea, 25 milligrams 1 to 4 times a day has been shown to help to prevent nausea. So looking for that vitamin B6 in there, and at least 25 milligrams is great, but even all the way up to 100 milligrams can be excellent as well. When we're looking at magnesium, my favorite form of magnesium is magnesium bisglycinate. Again, well absorbed by the body. It's gentler on the bowels, so it can still help to move things along, right, if we are experiencing constipation, especially constipation from that iron in our prenatal, but it doesn't tend to have too much of an aggressive effect on our bowels there. I like to see magnesium in a minimum dose of 150 milligrams to 200 milligrams there, and that can definitely increase, but again, usually the limiting factor is its effect on our bowels. The biggest side effect of magnesium is that it can cause loose stools, so if we usually are limited by how much we can take by that effect and impact on our bowels there. Other ingredients that we like to take a look at too is inositol. Myo-inositol can be a great choice for us. D-chiroinositol in appropriate ratios, at 40-to-1 ratio with myo-inositol can be helpful, especially if we have PCOS. Regardless, myo-inositol can be a great choice for most people. And usually, again, I like to see that dose in there of at least 1 gram. Even ideally 2 grams a day is a great place to start for inositol. Again, inositol can cause some GI upset, some loose stools, but if we increase it slowly, then we can usually avoid those impacts. Our body gets pretty used to it. When we are looking at choline, a dose of 450 milligrams a day is what is recommended for choline. And as our pregnancy goes on, the need for choline actually increases as well, right? As more and more of that brain development happens, which is great. And so when we are looking at this, We can definitely find it in a supplement form. The most common form that we'll find in a supplement for choline is choline bitartrate. And one of our best forms of choline is that naturally occurring form of choline, which is phosphatidylcholine, and our best source of this is eggs. So making sure to incorporate a lot of good eggs into our diet, especially into that third trimester, can be a really good choice. One of our final popular ingredients that we talk a lot about too is CoQ10. CoQ10 can be great for egg quality support, which is one of those things that can help us to get pregnant. And evolving research is showing us that it's also safe to take during pregnancy as well. It is also definitely naturally occurring in the body, so that is always helpful and promising there. And some things with CoQ10 are also showing us that it can help to lower blood pressure. So sometimes this can help to prevent preeclampsia in pregnancy as well too, which is always a complication that we want to make sure that we are preventing there too. A good dose of CoQ10 to start with is 100 milligrams a day. We can bump it up more if we need that, but I usually like to see it starting out at around 100 milligrams a day. So some high level takeaways from this are folate is the number one thing that we need in our prenatal, 400 micrograms a day. We want to make sure we have a lot of good B vitamins in there. This includes vitamin B12 and vitamin B6, can be some specifically really supportive ones in pregnancy, but also fertility. Same with vitamin D, looking for good antioxidants in there to help to support egg quality, and some more additional popular ones that can help to support hormone balance, ovulation. Again, can be inositol, brain health and development. We talked about choline and DHA. And DHA in the right doses that we need might need to be something that we take on separately. The easiest way to get that good dose is actually through a liquid. They do a really good job of making a lot of them taste a lot better than we might think these days too, so that is great to know and see. And we also talked about keeping calcium away from iron to make sure that we're allowing that good absorption of our iron there too. So follow our YouTube channel. We have lots more information on pregnancy and fertility. Let us know in the comments below other videos that you'd want us to make, and we will answer your questions for you as best we can.